And then what we're going to do now is I'm going to talk about coping. And so to try to give you some, so in this section we're going to talk about how to cope a little bit, some of the ways we're going to feel in more detail. And then, again, if there's any questions, otherwise then we'll move on to some specifics about the holiday. Coping onto itself, we could probably spend the whole time, an hour and a half or whatever, on just how do I cope. So I want to try to just give you a couple of pointers, because people say to me, you know, it was really helpful when you told me this exercise I did, and I found that useful. Before I do the good ones, let me just share a couple of thoughts on the not so good ones. Firstly, abnormal eating. I like to put this on the list, but as you know and I know, anytime under stress, we can do funny things with eating habits, right? And so whether you like to have something that's not so healthy, whether you like Twinkies, whether you like chips, you know, whatever it might be, as long as you don't do that for the next 7 years, you know, that's not the end of the world. But we just have to remember, I like to look at, and there's actually some major schools of thought that like to treat grief as a disease. And the reason they're saying that is if we can get the people like yourselves to realize that it's not like you have a disease, but if you had that mentality that you need to heal and that you need something to help you get better. And certainly with anything else that goes on in our life, and any other disease or whatever, eating properly and good nutrition, good physical health, good exercise, et cetera, is always useful. So the negative of that is being very abnormal in that pattern, you know, is obviously not as good. The next abnormal or negative way to cope would be if you really found that you were staying in bed or really getting overly depressed, obviously, and you're starting to not be able to deal with things and you're just avoiding them, all right? And I put purposely on the slide excessively staying in bed. And the reason I do that is because it's certainly not unusual at all for someone to have to call in sick for a day somewhere months after someone died in their family or whatever. I mean, that's just, again, that's normal. I even think if you were, this is not true, but if I were to tell you that I was in bed 3 days last week with the flu, no one would think that was abnormal. I mean, you might be worried that you're going to get sick from me, but it wouldn't be abnormal. But if someone said, you know, I stayed in bed 3 days a month or so after my wife died, people might think, uh-oh, you better start seeing a psychiatrist or somebody else. When the reality is they could be, you know, venturing into a dangerous area, and we need to be careful. But this is, you know, a tough thing to get through. So this is far more significant than the flu that's going on in your life. So we just have to give ourselves a little bit of credit and a little bit of patience with our progress, okay? The thing that gets bad would be if you find yourself, as I said, excessively, like I hadn't got out of bed for a week, I haven't been showering, I'm not feeding the kids, I'm not taking care of myself, you know, that's, you know, serious. And that's when, if a family member or yourself sees that, that's when someone really should get, you know, professional medical or psychological help, because that's gone beyond what would be considered normal. And lastly, a negative coping style would be drugs, not medication, but drugs, we'll say, and alcohol excessively again. You know, if someone says, I need to take a glass of wine every so often or to sleep, or, you know, I mean, that's not what we're talking about. We're talking about, you know, trying to drink ourselves into the point where we don't know that this is really, really occurring. The most negative, of course, I tend not to put it on a slide, that some people unfortunately do in how to cope or lack of coping really is suicide. You know, someone taking their own life as a result of this tremendous, stressful and traumatic time in their life.